where the numbers went up. Thanksgiving, Hanukkah, Christmas, Kwanzaa, New Year's Eve, all that socialization. Numbers went up. Numbers have been coming down since. New Yorkers did a good job of keeping that number down low. Many other states, the infection rate went higher, and they're in serious trouble. I think it's evidence of the fact that New Yorkers get it, and New Yorkers care about each other, and they've been smart. But that number continues to drop. We had 141 people pass away yesterday, and they are in our thoughts and prayers. And these are numbers, but remember, they're not just numbers. It's 141 deaths. That's 140 families. That's hundreds of people who are grieving today because they lost a loved one. That's hundreds of nurses and doctors who are again working in hospitals after a horrific year, and still rise to the challenge every day. Among the statewide numbers, highest positivity is Long Island, 6.1. Mid-Hudson is next at 6.03. New York City is 5.1. It's not in the top third. It's about in the middle of the 10 regions, New York City, but it's 5.1. In New York City, the Bronx is still the highest, 6.6. Next is Queens at 5.4. So it's the Bronx is significantly higher than any other borough in New York City, and that is problematic, obviously. Vaccinations, we've done about 1.96 million, so we're coming up to the 2 million mark. On the vaccinations, those that were scheduled for today or tomorrow in state-run facilities, they're going to be postponed. I know how hard it is to get an appointment. I know people will say, I had an appointment finally. Is it really going to get rescheduled? It's really going to get rescheduled in any state-run facility. So if you had an appointment, it will be rescheduled at a state-run facility. Overall, with COVID, vaccinations, it's just a question of supply, and it's a question of international supply and national supply. It's not really a supply issue, it's really a production issue. How many drugs can Pfizer, Moderna, any other manufacturers that they approve, how many can they provide? How many can they produce? How many can they make? Then how many does the United States purchase? And they then distribute to states by population. We are basically exhausting our week-to-week allocation, waiting for more supply from the federal government. And we have much more distribution in place than we have supply. There are 7 million people who are eligible for the vaccine. 7 million. When you add up the hospital workers, the healthcare workers, 65 plus population. That's 7 million people in New York City, in New York State. It's about half of the entire eligible population in the state is now eligible. But we only get 300,000 doses per week. That's the disconnect and the confusion and the tension. 7 million people looking for a vaccine, you only get 300,000 per week. So we're very careful about how we give out the doses. We give them out proportionately by population of an area. We then give them out proportionately among hospital workers, essential workers, and 65 plus by their percentage of the population. And the providers have select groups they're giving. But I understand the frustration. I've spoken to hundreds of people who said, I'm eligible, but I can't get it. I sit at a computer and just keep hitting the refresh button looking for a vaccination. I get it. That is a situation created by the federal government initially, and it is a national problem and an international problem, that there's just not enough vaccine. And I know the Biden administration is working very hard on that. They have made progress. I believe they're going to make more progress as we go forward here. But whatever we get, we will distribute. and we'll distribute it as soon as we get it. We just have to get it. Overall on COVID, the numbers are coming down. New Yorkers are careful. Even places that were highly problematic in the state are now coming down. The only question mark, what is a potential problem? If one of these strains, these variants, a new term, variants of interest, if one of these strains, these new variants, hits and is problematic, you could see that curve change. And that's just a question mark. Nobody can answer that question. I speak regularly with the best health experts globally, because this is not a state problem, it's not a city problem, it's not even a national problem. It's a global problem. And nobody knows, nobody can tell you definitively what the mutation of this virus will be. UK strain, Brazilian strain, South Africa strain, no one can tell you how fast it will take off. The UK strain is problematic. The CDC has said it would be a predominant strain, and it is more transmittable. But we'll know when we encounter it, and whatever we encounter, we will be ready to manage. But right now, that number is headed in the right direction. So congratulations to New Yorkers, because you make it happen, one way or the other. It's what New Yorkers do. How we act determines how that virus spreads. And bringing down that line, bringing down that surge, that's all due to the good work of New Yorkers. And I thank you, and I'm proud to be a New Yorker. Let's take some questions on this. Operator.
Thank you, Governor. If you'd like to ask a question, please use the raise hand function at the bottom of your window. We'll take a brief moment to compile the Q&A roster. Governor, your first question comes from Gwen Hogan of WNYC. Gwen, your line is now open. Please unmute your microphone.
Hi there, Eric. Can you hear me?
Yes, we can.
Thanks very much for taking my question. Two things. Can you clarify how the closure of above ground service will work? Does that mean that all lines that have above ground are just completely shut down, or just the parts that are underground? And then I just wanted to see if you could comment, preliminary data that was released this weekend about disparities in health, or disparities in racial demographic of who is getting the vaccine. I'm curious if, Governor, you've reflected at all about how your administration handled the first 2 months of this, if there are things that you think you did that exacerbated these racial disparities that we're now seeing, and what you could do differently to improve that in the coming weeks.
Yeah, on the disparity in the vaccine, I think we anticipated it. I think New York was the first state to predict this was going to happen. If you remember, or if you knew, I had been raising this issue since the Trump administration first announced the vaccine rollout. I said, you can't just rely on traditional healthcare means, because you're dealing with healthcare deserts. And when you just use the private healthcare system, you're not going to bring vaccine to the desert. That's why they're healthcare deserts. I said that this virus affected the black community disproportionately. Death rate in the black community was twice what it was in the white community. It's 1.5 times what it is in the white community and the Latino community. And there was less testing in the black and the poor and the Latino community. We set up a task force to work on just this. I work with black churches. We're doing vaccines in public housing projects, in community centers, in churches, exactly for this matter. So we have greatly increased access. You have two issues. You have the access to the vaccine, which is problematic all across the state, obviously. But we have significant special efforts in poor black and brown communities. I said that I'm not going to receive the vaccine until it's available in poor black and Latino communities for my age group. So I said, I'm going to put myself in that category. And we've been working on access. Of course, you can always do more, but we need more supply to do more. The second issue, which is also very real, is distrust of the vaccine. They call it hesitancy. Hesitancy is too benign a term for me. It's not hesitancy. It's distrust. Call it what it is. You have distrust, primarily in the black community, about the fact that the government says the vaccine is safe. And we talked about this last year when the Trump administration said, well, we'll tell you that the vaccine is safe. Yeah, but then you have the distrust of the Trump administration and the cynicism of the Trump administration and the cynicism of government in general. When you're talking about the black population, you're talking about a population that went through the Tuskegee experiment, right? So you understand why there's cynicism and why there's distrust. I said we'll have a New York State panel. I'm not asking you to trust the Trump administration. I said I wouldn't trust the Trump administration. We had a New York panel with New York doctors, and New York doctors will also check the vaccine to say it's safe. That was to build confidence in the vaccine. And we did that. But there is still distrust and cynicism. We took, if you want to talk about one control group, if you will, hospital workers have been offered the vaccine numerous times because we have a priority in vaccinating hospital workers. Why? Because if hospital workers get sick, then the hospital capacity goes down, then the hospitals get overwhelmed, then the state closes down, and people die unnecessarily. So hospital workers are in a different category. They didn't have to make an appointment. They didn't have to take a day off work. They haven't been sitting at their computer trying to schedule a vaccination. They're in a hospital where the staff has come to them and said, please take the vaccine. We have it for you. The declination rate among blacks in hospital settings, where they're hospital workers, is much, much higher than it is among whites or Latinos or Asians. So we know there's a real distrust issue. And I announced yesterday the state is going to start an advertising campaign to address just that. But it is a very real issue. We have to improve the access, yes. We need more supply, yes. But we also have to address this distrust issue head on because it's real. And I understand it, and I get it, and I understand why there's cynicism about the system in general. But, and I would agree a lot of times with the cynicism about the system, but not with this vaccine. I believe in this vaccine. And I've said, my mother, who is 65 plus, she doesn't like any reference to her age, but she does qualify as 65 plus. I'm 63. I don't think I'm giving away my mother's age. My mother should take it. My kids should take it. I believe in it. And we're going to have a full-throated effort and work with a lot of partners to try to communicate that to anyone who is distrustful of the vaccine, but especially in the black community. Let me ask Sarah Feinberg to give you more information on the subway service.
Thanks, Governor. So this is how this works. We're communicating to customers now, and we'll continue to do so, about the fact that outdoor service will be suspended at 2 p.m. So if you're in the system, you're going to hear announcements on the train. If you're checking Twitter, you're going to see it. If you're checking MyMTA, you're going to see it. We'll be reminding customers that they've got to get off in the underground stations. At the last underground station before the train enters the above ground tracks, we will disembark the train. Everyone has to get off. We'll explain why. The train will then continue on with its train operator and its conductor because the train will continue to sweep the snow off the tracks, which will help us continue to clear and recover from the storm. It'll get to the terminal, it'll come back, it'll start picking up customers again once it hits the underground station. So that's how it's going to work. And again, we'll resume outdoor service as soon as we can, as soon as it's safe to do so.
Next question, operator.
Governor, your next question comes from Therese Loeb-Cruiser at the Downtown Post NYC. Therese, your line is now open. Please unmute your microphone. Therese, please unmute your microphone.
Trying to do that.
You did.
Hello, can you hear me?
You did, yes.
Great,
Yeah.
thank you. Hey, Governor, I've got two questions for you. You can take your pick.
Okay, that's new, but I'll do it.
I don't want to monologue
Right,
you,
what's
but
option A?
all righty. One of them has to do with the fact that I'm looking at a great quantity of snow outside my window, and I happen to live in a floodplain. And I'm thinking ahead a day or two when all this stuff starts melting. And do we have any plans for dealing with coastal flooding? That's one of my questions. Do you want the other one or just,
Yes, I
just
want
that
the
one?
other one so I can make an informed choice between A and B. Go ahead.
You want to, okay, you want an informed choice. Okay, the other one has to do with another instance of what I believe is social inequity. If you have a lot of 75 plus people who are eligible for the vaccine, a lot of these seniors don't have computers. They live alone, or they're not very computer literate. They don't know how to get themselves into the system properly and keep trying. And they need some help if they're going to be able to actually get a vaccine and get a place for one.
Okay, I am going to opt for question B. I'm going to give option A. Ask Mike Copey if you want to talk about question A, which is after the snowfall, what if there is flooding in low-lying areas?
Yes, Governor, we're preparing for that right now. We have the stockpiles across the state that are open, and they will be ready to deploy pumps, generators, and other equipment to communities that may be affected by flooding. We also have the National Guard that is on standby, that is available to assist any municipality with sandbag placement and deployment should that become necessary.
On question B, it was question B. I understand totally about access to the vaccine and people who are not as fluent, if you will, in use of technology. And that's why on the state level we have a good old-fashioned phone number that you can call and talk to a good old-fashioned person who can make an appointment for a vaccine and tell you what places are available in your area. And I don't have the phone number off the top of my head, but we will. We have announced it, and I'll make it available to you afterwards. Next question, operator.
Governor, your next question comes from Josefa Velasquez at the City. Josefa, your line is now open. Please unmute your microphone.
Hi there. Can you guys hear me okay?
Yes, how are you?
I'm great. How are you?
Good.
So can you talk a little bit about the rationale behind opening indoor dining in New York City? The number of COVID cases here doesn't seem to be abating, and there's concerns among restaurant workers, many of whom work on minimum wage or tipped wages, who are people of color, that they're not eligible for a vaccine. So it's a two-parter. Can you explain your rationale for opening indoor dining, and are there any concerted efforts to include restaurant workers in the next batch or in the current batch of people who are able to be vaccinated?
Okay, 2 points. Look, if you're waiting, you're trying to balance two vital concerns, right? Economic concerns and public health concerns. The economic concerns are real. People need to work. People need to pay for their rent. They need to buy food. They need to buy clothes. They need income. The federal government is talking about us sending a check. You know, that's nice, but it's not going to be a substitute for a sustained income. So the economy and right to work, if you will, on one hand, and then public health on the other. if you look at New York City's numbers or any numbers in the state, they have dropped dramatically, as I said now, 24 straight days. The number is dropping. Your point, COVID isn't solved. That's true. More people are getting infected. That is true. But many fewer than were. If your premise is don't open the economy until no people are infected with COVID, that may not happen for years, literally. Yes, we'll have a vaccine, but you're not going to have 100% of the people take a vaccine. If you ask me my best educated guess, you're going to see mutations of the virus. You're going to see new strains. You will even see, if I had to wager, a strain of the virus that is resistant to this vaccine. And you'll see a second vaccine and a booster shot for the vaccine. So I don't think it's realistic to say don't open the economy until COVID is solved, because that's not going to happen. Well, make restaurant workers eligible. Look, I get the theory on restaurant workers eligible, immune compromised eligible, people with diabetes eligible, obesity, people with asthma eligible. And it's very easy politically to say, I think this one should be eligible. I think this one should be eligible. I think everybody should be eligible. The realistic situation is you don't have enough supply for any of these people. You have 7 million people eligible. Well, I think more people should be eligible. You have 7 million people, you only get 300,000 a week. What does it mean? And I get, you have a lot of politicians, and it's everybody stands up and says, I think police should get more. I think fire should get more. I think the restaurant workers should get more. I think child care workers should get more. I think the immunocompromised should get more. Fine. Tell me who you want to remove from eligibility. You want to add someone? We already don't have enough. Who do you want to remove? Do you want to remove teachers, police, fire, 65 plus? Who do you want to remove? Oh, no answer. It's a cheap, insincere discussion. Yes, I would like to see restaurant workers eligible. Makes total sense. But what does eligibility mean when you don't have the supply necessary? Next question, operator.
Governor, your next question comes from Paul Leota, the Staten Island Advance. Paul, your line is now open, and please unmute your microphone.
Hi, good morning, everybody. I just had a quick question for President Feinberg regarding the shutdown to the subway system. Does that apply to the Staten Island Railway?
Sure. So for now, the ferry continues to run regularly, and the Staten Island Railroad has been able to keep up with their snow removal, and so we're going to continue service on Staten Island for now. That said, prepare for us to have to suspend service at some point. So, head home and don't be out if you don't need to, but for now we can continue to operate service because the railroad's been able to keep up and the ferry continues to operate.
Good. Anybody want to make any last point? Pat, Rick, Mike, Sarah?
Get home.
Get home. Assume road closures, assume rail closings, assume subway reduced service. As Ms. Feinberg said, I would assume the worst with this kind of storm, and then plan accordingly, and then you won't be surprised. Any other updates, as soon as they happen, we will let you know. But again, you heard the caution from the MTA, the TBTA, Port Authority, and the head of emergency management. And again, from me, I've been out there. It really is dangerous. I know we're tough in New York. I get it. even with our New York toughness and smartness and unity, it's still dangerous out there. Stay safe. Thank you.